Hello and welcome to another episode of Spotlight on Health. I'm your host, Dr. Stephen Eschenauer, the Health Officer at the Kanawha-Charleston Health Department. And today I have a couple of very special guests. Those types of guests that a physician cannot work without, and that are nurses. Not just any nurses, school nurses. So I'd like to welcome Alicia and Danita. So Alicia, tell us a little bit about yourself and school nursing.
School nursing. So I'm the lead nurse with Kanawha County Schools. I've been in the lead supervisory position for the lead nurses. This is my 5th year now. I've been a school nurse for going into my 16th year. My background is in pediatrics. WVU grad, School of Nursing, class of 95. Worked at Ruby in the Children's Hospital for several years. Stint in North Carolina and hospital pediatrics in Concord, North Carolina there as well. Moved back home to West Virginia and pursued school nursing certification, and that's where I've been since. So, yep.
Excellent.
Yes.
A lot of experience, particularly
Yes.
in pediatrics
Yes.
and dealing with children and
Yes.
all the childhood diseases.
Absolutely.
Oh, yes. Oh,
Absolutely. Yes. And I currently sit on the board of directors for our National Association of School Nurses as a West Virginia representative. So that experience has been invaluable to me as well, just to learn how these kind of things affect other communities and how we can all share resources and strategies to help prevent things like this.
Excellent, excellent. Well, welcome.
Thank you.
And Danita is not only a nurse, she is also a board member at the Kanawha-Charleston Health Department and very involved in public health. So, Danita, tell us a little bit about your career.
So I graduated also from WVU a little earlier than Alicia. I've been a school nurse for 18 years and I'm backing off a little bit now, which has been very much mixed feelings. It has been a wonderful, wonderful career. And then when I was asked to be on the board, at first I'm like, I don't know, it's something out of my comfort zone, but then I thought, we work so closely with the health department. It is community health. That is what, as school nurses, that is what we do. We're the liaison between the parents, the medical practitioners, so jumped in and no regrets. It's been a wonderful experience. So.
And we really appreciate your input on the board because you bring experience in day-to-day work in our communities doing one of the most important preventative elements of public health, and that is childhood immunizations. So we really value your input, and it's been a pleasure to have you on the board.
Thank you. Thank you.
So let's talk about what this season is coming up.
Yes.
We're entering the immunization season.
We are.
Yes.
Back to school time where we, just all new enterers and those routine childhood immunizations that are required. The school nurses work very hard to, upon enrollment, to check those records and make sure that the students have what they need, and also give family resources and ways to obtain them. And the health department has always been such a great community partner in helping us with those endeavors, and as well as our 7th grade boosters and our 12th grade boosters. So we want to make sure, and that the school nurses truly are the gatekeeper for that information. I mean, it all comes through them. So.
Absolutely.
Yes.
A number of kids in West Virginia don't get caught up on their immunizations, as I understand it, until they go to school, until they see that first school nurse review and visit.
Yes.
Any idea on what percentage of kids in our county end up needing additional shots before they can go to school?
I would say I will take this opportunity to brag on our state as a whole and the efforts. So there are some. I would say it's a very small percentage.
I would totally
say it's a very small.
And a lot of times, like with preschool, we look at the 3-year-old shots. They don't really need to have those 4-year-old until kindergarten, so they're given a little bit of a time frame. But I have to say, and I do think we take it so seriously, because if we can get them caught up then they're gold. They're good for a while. So sometimes if they've changed practitioners or moved from one area to another, they may have had them, they just aren't they've lost that documentation. So that's one of the things that we stress is you have got to have one place where these all are. Because it's not just school, it's jobs, it's camps, it's military, it's, higher education. They all need to see proof of vaccine. So it's not over when they enter school.
Exactly.
So I think I think that school nurses as a whole are so proud of that. And if some slip through the cracks, it's like middle of the year, you're looking again, oh, right, I need to follow up on that and see where the documentation is. So it's a big part.
It is.
Yeah, West Virginia has some of the best immunization laws in the state to protect our children, and it does really show we do indeed have some of the best immunization rates across the country, and with it, some of the lowest rates of disease. Of those childhood diseases such as chickenpox and measles, mumps, rubella, the list goes on.
Yes.
Yeah.
It's really important that we protect children, and I really appreciate what you ladies do to keep our kids safe and keep our schools safe. So this past year was an interesting political year. A anti-vax bill was presented and was vetoed by the governor. I want to get a little bit on your thoughts and your perspective as you two are on the front line of children in schools and want to protect our children. So, Alicia, what do you think about this potential?
I think I'm grateful for all of the medical community's efforts, your efforts, the education that we need to provide to our legislators and to the public as a whole. I think the people who are against vaccine, I do truly feel that they are more of a minority, but they just tend to be a lot louder than everyone else. I know just in my role through the school system and even parts of the law, even through private schools and things, though even our private schools, the school nurses are assigned private schools as well. We don't, go there weekly and do, illness assessments, things like that, but we are responsible for checking their immunization records, doing their screenings, and even those private and parochial schools, really, they care about their students and the public health aspect of it. So they also are advocates for what we are saying in the medical community, and just think it's so important for everyone's health.
There were 28 organizations that came together that involved health or education, supporting our strong immunization laws, and to leave them unchanged. So Danita, what was your thoughts on the legislative session and what the future holds?
So much of what we do is education, and I think that for those that are anti, it is this learning curve, and I think that sometimes the school nurse is a less intimidating way of communicating. We're not their adversary, we are on their side. We are trying to be that liaison. So sometimes I think we get through, sometimes not. I was impressed with the 28, and even the one with all the signatures that they just rolled down the hallway at the Capitol, and all the phone calls. And every time I would call, they were like, we're hearing from you, we're hearing from you. School Nurse Association, the state advocacies. I was sweating it out. I forget what the deadline was, and you texted that he vetoed it, and just grateful, but knowing that here comes another fight, here comes another issue, and we'll be ready for it. I mean.
Let's talk a little bit about consequences. And what are the consequences when you don't get immunizations? What are the diseases that our children are protected from by very long-term, safe, proven childhood immunizations?
Right.
Either of you want to, I'll throw it up in the air. Who would like to talk about some of the diseases?
I think we can both mouth of each other. Because we are the gatekeepers of that information and the records, we know the schedule, we know the requirements, just second nature. We're diphtheria, pertussis, tetanus.
Pertussis. I mean, pertussis, that is one that, a 2-month-old cannot be vaccinated quite yet, but granny and aunt that are holding them, that if they have very mild symptoms, they might not even know, but it is so detrimental and deadly to a young one. So I think that information needs to get out there. some of the childhood illnesses we were talking before we started recording that are maybe not as deadly in children, but if you wait and get it when you're older, so many side effects and long-term issues. Polio that was eradicated. My husband's mother had polio.
Wow.
We don't see it, but we will. Third world countries have it and would love to have the immunizations that we have. So it's a scary, deadly thought. It just is.
For those that may not be familiar with pertussis, it's also known as whooping cough. And whooping cough it's a serious illness, especially for those young, very susceptible children under age 2 that cannot yet be fully immunized. So yeah, it is a big concern, because I'm sure you all would not like to see an outbreak of whooping cough in your schools. Let's talk about one of the most contagious diseases that we know of on the entire planet, and that is measles. One that fortunately we've not had a case in our schools in many years, and one that we don't want to see back in West Virginia, but would be one of probably the earliest diseases that we would see a spike in if we have a drop in immunizations. So, measles is a very unique disease in that it is easily spread human to human, even from the air that is in a room from somebody that had been in that room with measles. They don't even still have to be in the room. They could go into the waiting room of a doctor's office or an emergency department and infect everyone in that room who is unimmunized or underimmunized. And what I mean by that is that they may not have received at least 2 shots of the immunization. So we have up on our screen now a map showing how quickly measles can spread human to human when immunization rates drop. This is probably one of the most crucial diseases to immunize against because of how quickly it would spread through not just our schools, but the rest of our community, and particularly endanger young children that cannot even be fully immunized yet, especially in the hospital, newborns. Nobody wants to see a newborn with measles. This is a disease that we've almost essentially considered eradicated within West Virginia because of our best West Virginia immunization laws. And we would really like to keep it that way.
Yeah, absolutely. Absolutely.
I think we need to learn from our neighbors. I think from Ohio and Virginia and what we have seen with immunization laws that have been,
When you say learn from our neighbors, can you elaborate a little bit?
I sure
what
can.
happened?
So the measles outbreaks in schools or in the pediatric community in Ohio and in Virginia, and I don't want to quote the percentage exactly, but I know it was bordering of all of the measles cases that were in Ohio. I think that I read that close to half of those children were hospitalized when.
You're correct. It was close to half.
I thought it was close to half. I knew it was above 40, but wasn't quite sure what the. I'm very proud of us in West Virginia that our laws have continued to protect the community like it have, and I just would really like to see that continue.
Yeah, Danita, have you seen any measles cases in your career?
No.
I promise you, ladies, you don't want to.
I'm sure we don't.
I have spent a lot of time in third world countries, and these are sick kids. They are really in bad shape. They can get very dehydrated. It's a lot of pain. They really suffer. And when it's a disease that that could have been so easily prevented, and instead these kids suffer, and they suffer greatly. Yeah. So what are some of the other concerns? Say a big one that we worry about is meningitis, because you'll need that booster all the way to the 12th grade.
That's right.
Tell us what your thoughts are on meningitis.
Meningitis. It's, we discussed prior to taping too, you talked of your experience previously so many years ago, and as a pediatric nurse, you were talking about doing all of the spinal taps and lumbar punctures that you performed to rule out meningitis or sepsis as a young nurse. And even still, my senior leadership was also in pediatrics, so it's just always been my passion. But I can remember being in a teaching institution in Morgantown and just seeing in the treatment room when we're ruling out sepsis or we're ruling out meningitis on those infants, and just seeing how scary that it can be. And again, that's something as we're referring to all of these vaccines, things that are just entirely preventable, but meningitis is very scary, obviously, for smaller ones, but when we're talking about teens and how, it's totally, they don't feel there's kind of an invincibility there. They're sharing drinks, they're sharing items. If they're in a dorm, they're living in close quarters. There's just some things that can't be avoided. They're social beings. They're with their friends and things all of the time. So that just stresses the importance of it even more.
And I'll go ahead.
Well, I was just going to say, and that age group, normally when you're younger, you are seeing your practitioner every year, but then that drops off,
Oh,
except for
great
sports
point.
physicals.
Yes.
So I think to get the word out, and I know the high schools have done different things to incentive, as incentives. So it's like, oh, you can't get your parking pass unless you show proof of these, especially the seniors. So each school, I think, says it's whatever carrot is going to to work for them. But that is a group that isn't normally seeing physicians as often.
I will take this opportunity to also say how thankful we are for our school-based health center partners. We have Cabin Creek Health and Family Care and various sites around the county, and they absolutely assist us and complement our efforts to abstain if we have what we deem as a good portion of students that 7th graders, 12th grade, they will help us and hold clinics and things like that. And if they, if the parents have given consent for those children to be seen at school, they're right there. It's a perfect opportunity. So we're so grateful for them and the collaboration that they provide. So.
And even extended hours at the health department, just getting the word out on social media, anything that works, for sure.
So let's talk about the school calendar. So when does Kanawha County go back to school?
So staff, regular, so a lot of, there are many of us in administrative roles that work year-round. The principals high school and middle school principals are coming back now. Elementary will come back in a week or so. Teachers, regular school nurses, and come back August the 12th. The first day for students is August 16th.
August the 16th.
Yes.
So the target date to get your shots up to date is?
Now.
Is now.
Now.
Oh, yes. We want them. That's right. They're, supposed to have them on August 16th. Yes.
When I see patients that come in with lacerations or cuts or they've stepped on a nail, and I ask them when did they have their last tetanus shot, when they say, I don't know, I said, oh, did you say today?
Yes.
I heard today.
Yes, I heard today.
Absolutely.
Yes.
And today is the day to get back and get your school immunizations.
Yes.
Now is the time. Don't wait till the last minute. So let's talk a little bit about the schedule of what immunizations you get when and why. So what do kids need to have before they go to school, before that first kindergarten year?
So the first kindergarten year, they need 4 doses of DTP, which is diphtheria, tetanus, and pertussis. They need 3 doses of polio. They need 2 doses of MMR, 2 doses of varicella, and 3 doses of hepatitis B.
Think of all the diseases that we are not seeing in our schools because of those immunizations.
Yes.
Absolutely.
Yeah.
Yes.
And then the next round of shots for children or immunizations occurs at 7th grade.
7th grade. They need boosters then.
And what all boosters do they need in 7th grade?
They need a Tdap and they need a meningitis booster in 7th grade.
Tdap and meningitis. And then when you get to the 12th graders.
And then you need a meningitis. Yes.
Meningitis,
Yes. So.
Yeah, meningitis cases are probably some of the saddest cases that I see as a
So
physician.
Oh, absolutely.
So quick.
Because what would normally have been a very healthy child, typically not on any medications, otherwise very healthy, no medical issues or problems, and suddenly they are sick, and they're very sick. They come in, and they are very concerning to an emergency physician. nausea, vomiting, severe headache, neck stiffness. And some of these kids, they don't make it. Meningitis can be fatal. So it's just that is just one of the immunizations that is just so important because it's out there. Kids are, like you said, they're going to be social.
close,
They're going to drink after each other.
Sure.
They're going to kiss each other. They're going to hug each
They
other,
are.
and can easily spread it person to person. And if you're not protected, you're at risk, and that risk can come with a lifetime of consequences.
Yes.
Yeah, those are some of the saddest cases I see because I just think of how easily this could have been prevented just by having that booster on time.
Absolutely. Yes.
And then even if they do survive,
Oh.
have a lot of complications.
Yes, it can
Yes.
come with long-term consequences. It's not just giving a dose of antibiotics and saying, "Oh, you're fine, you're
Yeah.
well."
Right.
Not necessarily so. Not
Yeah.
necessarily so. Yeah.
Prevention.
Yes. Yes.
As my grandfather used to say, the easiest disease to treat is the one you never get.
Absolutely.
Oh my goodness. Wise words for sure.
Sounds like a
Yes.
t-shirt.
And
It does. It does.
And I continue to preach that in as much messaging as I can because
You know, you also, Dr. Eschenauer, referenced, we went over kindergarten. We have preschools, not just the preschools that are in our elementary schools. And the majority of our elementary schools have preschool sites. And then we also have collaborative preschool sites, whether they're at a private or parochial school or a daycare, those two. The nurses are involved. Then as Danita said, from the get-go, the preschool requirements are a little different. They can be in preschool and not have those 4-year boosters. Some pediatricians do those kindergarten boosters at 4, some do it at 5, but the nurses are the gatekeepers there as well and really work to educate the families and make sure that they stay on time and don't neglect those last bits so they're ready to go for kindergarten. Yeah.
talking about education, because today I think many young parents never experienced, never knew. As you had a friend or family member with polio. We don't see those diseases today because of immunization, so they don't see it, and it's not that they've forgotten, they never experienced it, they don't understand the risk. What efforts do you make towards education to tell them why these diseases are really bad for their children and can kill them, disfigure them, make them extremely ill, cause terrible suffering, and may cause a lifetime of disability?
And I think we need to meet the parents, the caregivers where they are. Scare tactics sometimes it's just, did you know, or have you heard about this outbreak? This is a state that maybe didn't have the immunization laws that we do, and this is happening. So even though we may not see it, it's coming. People travel. We are not in our little core group. So, you talk about community, what's the word I'm looking for, that if the majority of the people have the vaccine, then you're a little protected. That works in some situations, but not when you're on a plane, not when you're, in Florida with all the other ramifications. So I think it's just, yes, educating them on this isn't that far away, and even sharing our experience. My older daughter did have chicken pox, so that isn't that long ago that we've seen some of these things that now we're preventing. So refreshing them memory.
We also, as you all know, West Virginia has a very high percentage, close to the top of grandparents and other caregivers raising the grandchildren. So that is such another. So a lot of these grandparents probably do know someone that has, experienced or been afflicted with some of these preventable diseases, but that also makes them more vulnerable to illness. So we need to, it's not just about, certainly it's about protecting the public and the community as a whole and those caregivers as well. Yeah.
Good, that's a very good point.
Yeah, it's a constant battle to educate and inform so that we know how to communicate to parents and children alike, because children do get older, the 12th grade, and want to make decisions that could come with lifelong consequences, good or bad, about how to message so that it's not so much about scare tactics, it's about understanding the benefits.
Yes.
And understanding what the consequences are, what these diseases mean for our community. And it goes beyond just whether or not you get a shot or a jab, as some say. It's also about financial ramifications, it's about human life ramifications, and it's about suffering. I remember as a child having chickenpox around age 5. I think it was between my kindergarten and first grade year, and I felt so bad that I couldn't even get out of bed. I remember my mom having to come and pick me up and carry me to the bathroom. I was so weak I couldn't even walk, and how miserable I felt. To this day, it's just seared in my brain of how much pain and suffering that disease caused. And I don't want to see that on any child. And I know that you ladies don't either. We want to protect our children.
Yes.
Give them a safe and happy childhood and safe schools where other children who cannot be immunized for one reason or another can come and feel safe that they do have herd immunity around them. And that gives them some protection.
Yes.
Because not everyone can be immunized.
Right. Right.
So last bit on waivers. There are legitimate times that some children cannot receive immunizations. And medically, I know that there's a process. Can you tell us a little bit about that?
So in order to have, as we know, but so that the public knows, the only exemptions legally permitted in West Virginia are medical exemptions. So that process actually starts with the child's pediatrician or their family doctor, and that they need to submit to the state health officer the reasons and a pretty detailed history of why the immunizations would be contraindicated. And it starts with the parent, and it goes from the physician, and the physician submits it to the state health officer for approval or denial as to where that. And then when we do have some in the school, and then, obviously it's not something that's commonly done. So we have those handful of students. The state is very good about getting that documentation to us as nurses, and we keep it on file and that. But it's something that we try to educate the families as well and tell them that the process, because sometimes I will get a call in my office that says, well, and the parent may think a routine reaction is not necessarily an adverse reaction.
Well, ladies, unfortunately we're running out of time. This has been a great discussion, and I want to thank you both, Alicia and Danita, for joining us today on Spotlight on Health. And I want to thank our many viewers about the show. That we thank you for listening, and we encourage you to get your childhood immunizations to protect you, your children, your grandchildren. Thank you very much, and have a great month, week, day, whichever it may be.